Guys, welcome back to Rosary Group Limited YouTube channel. My name is CJ. I am your host for another segment of The Other Side of the Mic. And I'm here again with Dr. Cabello. How are you doing?
I'm blessed, thank you. And how are you?
I'm doing great. So today we're going to discuss yet another topic that affects mostly the women reproductive system, and that is fibroids. That is what we're going to be talking about today. So if that is something that you feel like you're interested in knowing, please stay tuned and take your pens and your notepad and take some notes. Dr. Cabello, on to our first question. So, what are fibroids and how do they develop in the body?
Fibroids are non-cancerous cells or non-cancerous growth that develop in the uterus. Okay. They are also known as uterine fibroids, myomas or myomas just. Okay, and then now you see fibroids, they are made of smooth muscle cells and connective issues, fibrous connective issues. Okay, so that is what fibroids are, first of all, because you asked in a layman's language.
Yes.
You know, we like to break things down.
That is it.
And I think I like to say that fibroid is a parasite to me that comes feeding the system and then grows up together.
Okay.
It's an extra body. It's a growth, something that happens that it starts growing, but it is living. You understand?
Yes.
So hence I would prefer to call it an extra body, an alienated body, which is not part of the system, that comes to live in the system and feed from the system and grows from the system.
Okay.
So you asked about how do they develop in the body?
Yes.
Fibroid, they are formed in the muscular wall of the uterus, either inside or outside, it depends. Okay. And the exact cause of fibroid isn't well understood. That is why I said it is kind of foreign body to me, my explanation to a layman. Now, but they grow in response to estrogen and progesterone, okay? And two hormones involved in regulating the menstrual cycle. Okay. Now, second, fibroid could come as a source of as a genetics. It could be as genetic. It could come as genetics. How? Because first of all, if fibroid runs in the family, let's say your mother might have had it. Okay, your grandmother had it. It's like there is a situation. Hence, I do tell people from time to time, the human skeleton, the human body is different. But now, when it comes from this pattern to this pattern to this pattern, automatically you see trace of connectivity of those bodies. So you also have the cellular change, which I'll tell you that fibroid develop from a single muscle cell in the uterus that starts growing abnormally. Okay. You understand?
Yes.
So it develops from a single muscle cell in the uterus that starts growing abnormally. Over time, the cell multiplies, forming lumps or tumor. So you see, it has different options of how it is developed. Now you have the hormonal influence. You have estrogen and progesterone, which stimulates also the uterine lining during menstrual cycle, can also cause fibrous cells to grow faster than normal. Okay. You also have some other factors. Some researchers will suggest that other factors such as obesity, the diet, environmental exposure, which I will talk about all that.
Yes.
They also might contribute. Yes. So if you ask me now that how is it varies in sizes, and tiny seedlings to large masses, it depends on how it is. And some women may not have symptoms while others experience it. Heavy menstrual bleeding, pain or pressure from the pelvic area.
Yeah. When coming to that was actually your second question. Like, what are the common symptoms of fibroids?
Okay, now let me just, the symptoms of fibroids vary, like Joseph said.
Yes.
They vary in sizes, number, locations, where it is located in the system. It can be inside, it can be outside, but it's still in the uterus. Okay?
Yeah.
Now, and some symptoms could be like, for example, the heavy menstrual bleeding. Okay, some women they suffer excessive bleeding during menstruation. Okay, and between periods, those are some common. And then you have the pelvic pain or pressure. Okay, I don't know if you want me to just rush or I should take my time.
Just take your
Because if I'm
time.
supposed to take my time, I'll tell you that fibroid can cause the feeling of a pressure or pain in the pelvic area.
Okay.
Okay, and can sometimes be severe or may be felt as a dull ache or sharp pain.
Okay.
Okay, now you have the abdominal enlargement. That is also another symptom. The abdominal enlargement, which you discover large fibroid can cause the abdomen to appear to be swollen. Okay.
Yeah.
Now, this happens for various reasons depending on how big the size of the fibroids are.
Okay.
We've had cases where fibroid, we had to operate patients and remove live fibroid. It's very heavy, huge. It depends on. So you could think the woman was pregnant, but
Yeah.
it was fibroid. So you have those cases. So it could cause the stomach to be that big, and you feel that way. Then you have the frequent urination, which is another symptom. Okay, because in fibroid, when the fibroid is pressing on the bladder, it can lead to frequent urination because the weight on the bladder will want you to always
Yeah.
go urinate. Then you have difficulties in emptying the bladder. It could be another symptom for you to know that you have fibroid. Okay, like a large fibroid may also make it difficult fully to empty the bladder because it's blocking maybe the passage, so you urinate in bits gradually. So you have painful intercourse. Sometimes you see some men who are like, I cannot do with my wife because every time I want to do, she's complaining. Sometimes it's necessary to check if she doesn't have fibroid. You have constipation. If fibroids are pressing on the rectum, they can cause constipation or difficulties in passing stool. Okay, you have back pain. Large fibroids can sometimes cause lower back pain. You have leg pain. In some cases, fibroid can press on the nerves. Okay, leading to pain and discomfort in the leg. Sorry.
A whole leg.
Yes, you can feel a pain like down this, on your hip.
Okay.
So if someone is experiencing any of the symptoms, it is important to consult a healthcare practitioner
Find out.
for an accurate diagnosis and appropriate management of the situation.
Okay. So how does fibroids affect a woman's reproductive health?
The truth remains that fibroid can really impact women's reproductive health in several ways. For example, you have the menstrual irregularities. Okay, fibroid can cause heavy or prolonged menstrual bleeding, which can lead in anemia and significant discomfort. Okay, you have infertility. Yes, infertility. Fibroid themselves may not always cause infertility. Just take note of this.
Yes.
But they can affect a woman's ability to conceive in certain situations. Large or multiple fibroid can distort the uterine cavity or interfere with the implantation of an embryo. So it's possible for that. You also have a pregnancy complication. Okay. Now, fibroid can increase the risk of complication during pregnancies. You can get miscarriages. Okay. You stand a higher risk of getting miscarriages. especially if you're dealing with a big fibroid. You have a pattern birth or preterm birth, let me say so. It could cause your
Unborn child.
Your unborn child to come in before
The time.
the time,
Okay.
because they are kind of like occupying similar spaces.
Oh, so it's kind of like reduces the
Good.
space for growth.
Yes. So you have abnormal fetal position, okay, and fibroid can affect the position of the baby, leading to breech presentation or other malpositions that might require cesarean section.
Okay.
Another thing is fibroid. You see labor and delivery complications too. I remember this particular case whereby this lady had fibroid, and before, well, whenever you try to position her for the C-section, the fibroid also positions itself.
So that big.
It was that big. Okay, so you have, okay, as I said, labor and delivery complications. During labor, fibroid can obstruct the birth canal or make it more difficult for the baby to pass through, potentially leading to cesarean section delivery. You have the pelvic pain, which is one thing. The presence of fibroid can cause chronic pelvic pain or discomfort, which might affect the woman's overall quality of life. You have the endometrial changes. Fibroid can affect the endometrial lining of the uterus, which may impact the ability of maintaining pregnancy. Okay, now that is it. And I used to tell people managing fibroid or management options of fibroid include medication, because that is something we can see. You see, it includes medications which could be given. You have the lifestyle changes. You have the various surgical procedures, which are some of the things that can be done. There is the fourth one, which I will not talk about. That is menopause. It's coming up soon.
Okay.
It helps remove fibroids from its roots.
Okay.
And it falls off. You can just tear to pick up, or it comes out through the vagina. So that is an option that has not yet been known in the world to an extent, but it's a research that has been successful.
So initially now they just cut the top part.
Yes. Normally what has been done so far is, this is the fibroid.
Yes.
It is in the body.
Yes.
Now if I come to do a surgery, I cut here.
Oh, so you leave it to grow.
You understand?
Yeah.
Now, let me do it this way. This is the surgery I have come to do. This is the fibroid. When I come to do the surgery, I cut.
So you leave
Now, it's flat here, it's operated. We throw away the side. But now, at this point, you get to understand that the roots are still there,
Yeah.
and it keeps growing again. Now, once it grows, this is what happens. You've heard some people tell you, she has multiple fibroids.
Yes.
Now, this root now germinates to this side or this side, giving it multiple sector. But now when this particular product comes up, it helps the fibroid comes out from its roots. And you will never suffer fibroid again. That thing is coming.
I need it comes soon because that's another one.
Okay.
So are there different types of fibroids?
Yes, there are several types of fibroid classified based on their location within the uterus. Okay.
Yeah, it's recorded.
Okay. For example, you have the intramural fibroids. Their location. You see, this fibroid grows within the muscular walls of the uterus, and their impact is that they are most common type, and they cause heavy menstrual bleeding, pelvic pain, and pressure. You have now also the submucosal fibroid. Okay. Now its location is mostly the fibroid developed just underneath the inner lining of the uterus. That's the endometrium. Okay. And protrude into the uterine cavity. Okay, its impact, they are less common, but they can significantly affect menstrual bleeding, causes severe pain, that may lead to perfect fertility. It can impact fertility.
Okay.
So much. Make sure you edit that space. Okay. Now, this fibroid also, you have the subserosal fibroid. Okay, it's located under the outer wall of the uterus, extending towards into the pelvic cavity. Okay. So it grows on the outer wall of the uterus, extending outwards towards the pelvic cavity, and their impact is they can cause pelvic pressure pain and may lead to urinary or bowel symptoms of if they press on the nearby organs. And they usually don't affect menstrual bleeding as much. Okay, but now that is why you discover these particular ones, they kind of like you have to always go to the bathroom if it is close to the organs, depending on what organs. If it is the rectum, then you have to see that you may have a lot of constipation. If it comes to the bladder, you see yourself going to bathroom very, very much. So you also have the pedunculated fibroids, which are located. They are attached to the uterine walls by a stalk, and can be found inside the uterus. Okay, and their impact is they grow. If they grow on a stalk, they can cause pain if the stalk twists or becomes inflamed.
Okay. Interesting.
Are you lost?
No.
The thing is just this.
Surprised.
The thing is just this. Each type of this fibroid can present different symptoms. You understand?
Yes.
And may require different management approach based on their sizes.
Okay.
You understand? And based on their sizes, based on their location, and the impact they have on the individual self.
So let's say it's most because you've talked about the rectum. So in short, fibroids affect the reproductive and digestive system.
Yes, it's possible.
Okay. So it's not just about the reproduction. Okay. Can men get it?
No.
It's just women. Because
I have never heard of cases where men have fibroid.
Okay. I think also because of the hormones.
Yes.
They only found in men, right? They in women, right? Okay. So what are the available treatment options?
Treatment options of fibroid vary depending on the size, location, and symptoms.
Okay.
And the individual's overall health and reproductive goals. Okay. And there are some main which I can give you. Number one, you have medications. Okay. There are different types of medication: hormonal therapy, birth control pills, hormonal release, intrauterine devices, the IUD. Yes. Okay, we talked about IUD the other time.
Yeah, we talked about
and hormone therapies can also help to manage some of the symptoms, okay? By regulating menstrual bleeding and reducing pelvic pain. Now you also have the gonadotropin. It's a release hormone, which also these drugs can shrink fibroid by reducing estrogen and progesterone, okay, and levels, but they are usually used short term due to potential side effects. You should put that into consideration.
Okay.
We also have anti-inflammatory medication, non-steroidal anti-inflammatory drugs, okay, can help alleviate the pain and discomfort, okay. You have progestin releasing intrauterine device, okay.
Yeah.
These also help control heavy bleeding and reduce symptoms. Now that is number one. You have the non-surgical procedures. the non-surgical procedures, which is a uterine artery and uterine artery embryonisation. And this procedure involves blocking the blood vessels supplying the fibroid, okay, causing them to shrink.
And not leave completely. They're just shrinking.
They shrink. They shrink, and they can. It depends if you don't feed them. They can shrink and then decide to grow somewhere else if possible.
Oh, no.
Yes.
Where there is supply of blood.
Yes. Now you also have those MRI guided focus ultrasound. Okay. This technique uses high intensity ultrasound waves to destroy fibroid tissue while sparing surrounding tissue. So that also is good. You have the endometrial ablation, and this involves destroying the uterine lining to reduce menstrual bleeding. Okay, it is usually more effective for submucosal fibroid.
Okay.
We shall speak English.
The next question.
The next thing is the surgical option.
Yeah.
Okay.
Yeah.
You have the myomectomy, which removes only the fibroids while preserving the uterus.
Okay.
Okay, and it can be performed via hysteroscopy through the vagina and cervix. Laparoscopy, minimally invasive with small incisions. Okay, incisions, or the laparotomy, that is the open surgery with large incisions. So
Like
it
a
depends.
C-section.
It's still like a C-section is possible too.
Okay.
So sometimes you just get a simple cut like this. Sometimes you can get a large cut. So it
Depending on
depends
the
now.
size.
Yes.
Okay.
Then the observation, you have the watchful waiting. Okay. Okay. There's also lifestyle. There's lifestyle and home remedies. That's diet and exercise, stress management. That also is something you can do to help relieve practice of, to help relieve it. Okay, you also have observation, watchful waiting, which in some cases, especially if fibroids are small and not causing symptoms, regular monitoring without immediate treatment might be advised.
Okay.
So the choice of the treatment depends on the various factors,
Okay.
including the size of the location of the fibroid, the severity of the symptoms, the desire for the future of fertility, and the overall health of the patient. Consulting with a healthcare provider is essential.
Okay.
Okay.
So, we're done with that one?
Yes, you ask if can fibroid become.
Yes. So, can they be cancerous, or they always, or they're benign? Like, can they cause cancer?
Okay. Fibroid are generally benign, okay, and are not considered cancerous,
Okay.
okay. So they are non-cancerous growth of the uterine, okay, muscles tissue. But however, there are rare cases, there are some risk that a fibroid could develop into a type of cancer known as leiomyosarcoma.
Okay.
Okay.
Yeah.
And which is a malignant tumor. It's a huge tumor of the smooth muscles. This is extremely uncommon.
It's uncommon.
It's very uncommon, but
But it can
it's not like it doesn't
exist.
exist.
Okay.
That's a leiomyosarcoma.
Okay.
So you have, there are some points I will always tell people to note when I'm talking about fibroid and cancer. Okay, most fibroids are benign and do not increase the risk of uterine cancer. So let somebody not just come and say, "Oh, fibroids are cancerous." No, but there are some cases which is not very common. Okay, and when I talk of leiomyosarcoma risk, this is a risk of a fibroid becoming cancerous. It's very low the risk is very low. And leiomyosarcoma can occur, but it's rare, accounting for less than 1 in 1,000 fibroids.
Okay.
Okay.
Yeah.
And then you have symptoms monitoring, which I have just talked about. This regular monitoring and evaluation by the healthcare provider can help ensure that a change in the fibroid be investigated further. Okay, you have diagnosis and testing. It's something that you also need to do so that you get to be sure that, okay, I'm doing the right thing and this is not really it or this is it.
Okay. So how does age affect the likelihood of development, and why is there rising cases of fibroids in teens and young adults now?
That is a very huge question. And I think answering that question, we have to identify some things. But first, age plays a significant role in the development and prevalence of fibroid, okay? It affects the fibroid development, and why cases might be rising among the teens and young ones. I'll give you the reasons.
Yes.
Now, look, for example, age and fibroid development. Can we start with that?
Yes.
Reproductive years, fibroids are most commonly diagnosed in women during their 30s and 40s.
Yes.
Okay? When hormonal levels are fluctuating, estrogen and progesterone, which stimulates fibrous growth, are higher, are at the higher levels during these years.
Yeah.
Okay? Secondly, menopause. Fibroids often shrink or become less symptomatic after menopause. Okay? After menopause, due to decreased level of estrogen and progesterone. Okay? And this is why fibroids are less commonly diagnosed in women over 50.
Okay.
Okay? But now I have had cases of women with 50 that have fibroid. Now, if you've left it for a long time, it keeps growing.
Yeah.
Okay? Now, it will not just fall off. I've had women of 60 who have fibroid. Okay? Now, if you neglected it, enjoy the pain for a number of years, it will keep growing even after menopause. Okay? Now, the second question you asked, the rising cases in teens and youth, adults, right? Now, you have the hormonal changes. Teenagers and young adults experience significant hormonal changes as they go through puberty. Okay?
Yeah.
Now, increased level of estrogen and can contribute to the growth of the fiber. Okay? Now, you also have early detection, improved awareness, and diagnostics technique may also lead to more frequent detection of fibroids in younger individuals. So the reason why it is now at this point is because because people are not aware, they don't check. So the more we check, the more we see. Okay? Genetics and lifestyle, I told you about the genetics. Genetics, the way if your mother had it, your father had it, and you have a particular lineage. See, this thing of genetics is something that people do not really understand. If I am a father, I carry the features of my father, whether physical or non-physical.
Yeah.
You understand? In me, you will see trace of my lineage. In my son, you will see trace of my great grandfather.
Yes.
That is just it. So you also have the lifestyle. All do play a role. Okay? Like diet, environmental exposure could also play a role. And then you have increased screening. More you screen, more comprehensive an approach and proactive health screening will identify fibroid in an early age.
Yeah.
So although fibroids are more uncommonly diagnosed in women in their 30s and 40s, okay? The rising cases in young individuals could be due to a combination of hormonal, genetics, and lifestyle factors, as well as advances in diagnosis technique. So regular checkups regular checkups and discussions with healthcare providers are essential for managing and monitoring fibroids regardless of age.
Can we link fibroids to family planning? Can it be linked? Because with family planning, you're also introducing a hormone in the system.
Yes, if linking as in can family planning cause fibroid?
Yes.
No. I have never heard of a case of that.
So, what are the lifestyle changes that can reduce the risk of fibroids?
There might not be any guaranteed way to prevent fibroids. Certain lifestyle changes during the risk, okay, or manage symptoms. But there are some things that are advised, okay, some strategies that might be beneficial, okay. You have, for example, the healthy diet, fruits and vegetables, diet rich in fruits and vegetables, like hormones level, and reduce the risk of fibroids. Yes.
Just keep a good diet, exercise.
A good diet. Whole grains can also maintain healthy weight and provide essential nutrients for the system. We also have lean proteins. Incorporating lean proteins such as chicken, fish, and legumes support overall health. Okay. You also have regular exercises. Which are some things that I always tell guys, better we go. I don't tell ladies, better you do it, and then you see how you help yourself. Physical activity, regular exercises can help maintain healthy weight and balance hormone levels, which may reduce the risk of fibroids or help manage symptoms. Now, weight management is another thing. Okay, maintaining healthy weights, obesity, and excess body fat can lead to increased estrogen levels, which might contribute to fibroid growth. Okay, and then you also have limit alcohol and caffeine.
You don't take them who are addicted to coffee.
Yes, that is why I say we limit alcohol and caffeine.
Okay.
Because it is necessary we do that.
Yep.
Okay. You have you reduce the consumption. Okay. There is also avoiding environmental toxin, reduce exposure. Okay. Exposure to some kind of toxins. You manage your stress. Okay. Regular checkup, routine health examination. They are all necessary.
Yeah. What is the impact of fibroids on pregnancy and childbirth?
Have you on?
Yes.
Okay, fibroid can have various impacts on childbirth, okay, and pregnancies, depending on the size, location. Remember I told you that. And first of all, I'll just try to take it a little faster based on the situation and how you have miscarriages. It could affect the child such that it causes miscarriages, okay, the pregnancy, especially in the location within the uterine cavity, okay, the submucosal fibroids, and can increase the risk of miscarriage. So the more it grows, you see, like the uterus.
Yes.
Okay. So now, the more it grows, the more it expands and it blocks
the uterus.
So that sometimes it could cause difficulties. Okay, for the woman to take in, and it could also cause easily the child to fall out.
Because it's pushing down.
It's pushing down. So it can increase the risk of miscarriages. So you also have the preterm birth, okay? Large fibroids or those causing significant pressure on the uterus can increase the risk of preterm birth. Okay. Now you also have the placenta abruption. Okay. The placenta fibroids can increase the risk of placenta abruption, where the placenta separates from the uterine wall before delivery, and can lead to complications for both mother and child. Okay. Now fetal position. You see, there's abnormal position. Okay, and fibroids can affect the position of the fetus. Okay, potentially leading to the breach of breast presentation. The baby's position fits first, so that instead of the baby coming down with the head, it comes down with the feet, or other malpositions that might complicate delivery also. You have the labor and delivery, which also fibroids can affect. First, it obstructs labor. It can obstruct labor. It can obstruct a cesarean section. The uterine contractions. Also, it can interfere with contractions. Okay, it increases the risk of postpartum hemorrhage, bleeding risk for women, and you have managing and monitoring, close monitoring in cases of where that is the situation.
Okay. Is there a link? Is there a genetic link with fibroids? Like, is it genetic? Is there a component that is genetic when it comes to fibroids? Can it be inherited?
Yes, it is evidence to suggest a genetic component to fibroids.
Okay.
It is, and they can indeed run in families. Okay. See, for example, when you have a family history, when a woman. Women with a family history of fibroids are more likely to develop themselves. Okay, and studies have shown that having the first degree relative mother or sister with fibroid increases a woman's risk of developing fibroid. Okay, genetic factors. Researchers believe that certain genetic factors may play this predisposed individuals to fibroid. Okay. So, specific genes and genetics mutations related to hormones regulation, cell growth, and tissue repair also. Okay. It might contribute to the development of fibroid. Okay. Now you have hormonal influence. Since fibroid grow in response to estrogen and progesterone. Okay. Genetic variations affecting hormonal regulations could influence the likelihood of developing fibroids.
Okay.
You understand? So now research, you see, ongoing research and investigation ongoing research is investigating the exact genetic mechanism and how they contribute to fibroids development, while a direct genetic cause has not yet been identified.
Okay.
Okay.
Yeah. Can they be occur after surgery? You said now you have to go through surgery and you need to remove the fibroids out. Does it come back?
Yes, fibroid will occur after surgery. Just like I said before, and I gave the example using my pen.
The pen, yeah.
Yes, fibroids can recur after surgery. Will occur after surgery.
It's common.
It's common. The likelihood of recurrence depends on the type of surgery performed and the various individual factors. For example, when you see like myomectomy, recurrence risk. After myomectomy, surgical removal of fibroid while preserving the uterus, there is a possibility of a new fibroid to develop after a time. Okay? Factors influencing occurrences. The risk of reoccurrence can be influenced by the size, number, types of fibroid. Okay? Remember I talked about simple and multiple fibroids.
Yes.
Okay, and the types of number of fibroids removed, as well as the hormonal factors of and genetic predisposition. Okay, so that is a myomectomy.
Yes.
Okay, recurrence risk. Hysterectomy, for example, removal of the uterus. That's different. Typically eliminates the possibility of fibroid reoccurring.
Okay, but that's like a permanent solution.
That's a permanent solution.
Okay.
Then now, that is for people who have already had their children and want to.
Or maybe now it's like a case that cannot be salvaged.
It cannot be salvaged anymore.
Okay.
Yes.
Right.
So, and you know there are different types of hysterectomy, right?
Mm-hmm.
There are different types of it. You have a total, the subtotal, or the radical, which can be done. Then you also have a post-surgery monitoring
Okay.
and then management of risk factor.
Okay.
So that is that.
Right. So let me just ask a question that it's not really connected to fibroids, but it's connected to the hormone system. What causes a woman to miss their periods even if they're not in any type of contraceptives? There are women who they just miss their periods for a period of time.
First and foremost, pregnancy.
Mm-hmm. They are not pregnant.
No, you have asked what?
What? Yes.
First and foremost, you didn't say whether they are pregnant.
Pregnant or not, yes.
So that's why I'm telling you. Number one is pregnancy. Most women, when you miss your period, it's a sign of pregnancy, especially if the woman is sexually active. Okay, but I've had a case of a child of 9 years old, or I've heard of a case of a child of 9 years old whose elder brother masturbated and wiped with a towel, and she used the same towel to bathe and wiped herself, and she became pregnant. Okay, so now that part is different. You also have another thing, stress. Statistic has proven that the North Korean women, most of them do not even see their period.
Kim Jong-un's place.
Huh?
Kim Jong-un's place.
Kim Jong-un, yes. Kim Jong-un. Yes, so most of the women do not see their period.
Wow.
So if you see your period, often that means you are wealthy and you live life. So that is another thing. So emotional and physical stress. Then the weight fluctuation also matters. Okay, significant changes for people who gain or loss, as well as condition like anorexia. Yeah. Can impact menstrual cycles also.
Anorexia means the loss of weight, like
yes.
Serious loss of weight. Yeah.
It can. Even bulimia.
Bulimia.
Yeah, it can also.
Okay.
So you have excessive exercise. Now, when I say do exercise, I don't say go and run for the road. Go and kill yourself. There's some people who go so far. Okay, intense physical exercise. Women who engage in excessive exercise have a low blood fatigue percentage and experience disruption of menstrual cycles and miss periods.
Okay. So it has a vast reasons why.
Yes, there are a lot of reasons. I can list a lot. I can continue if you want me to. You have thyroid disorder. It's one thing. You have polycystic ovary syndrome. Polycystic, yeah.
Yes.
Ovary syndrome.
Okay.
That also can affect. You have premenopause. It's another thing. Chronic illnesses can also, diabetes can also. You have medications, side effects can also. You have uterine or ovarian condition, structural issues can also. Okay. So there are different
reasons.
So if a woman misses her period and is not in any type of contraceptive, it's important that she consult the healthcare provider.
Okay. Yeah, so we've come to the end of our session today. Thank you so much for tuning in. As usual, if you have questions, you can comment down below. Let us know what your concerns are, and don't forget to subscribe, like, and share this video. We see you on the next one. Bye.